I'm Dr. Chirag Borana, a consultant orthopedic and joint replacement surgeon, and I specialize in robotic hip and knee replacement surgery. Today I will talk to you about knee arthritis and total knee replacement, partial knee replacements, and how robotic is helping us, to get a better outcome for your knee replacement surgeries. To start with, I would explain you in brief what is arthritis. As in how you age, your knee becomes arthritic or degenerated, and that's when you start getting knee pain and you find difficulty in walking and doing your daily activities. In advanced stages, knee replacement is the best option that gives you a life and gives you mobility. Total knee replacement surgery has been there for last 3 to 4 decades and the results are astonishing. But with new techniques and new technology, we want to reach higher skies and we want to get better outcomes for every patient every time. So this is where the robotic system help us to achieve precision in every patient. Here what we basically do is we have a 3D CT scan done of the patient where we take complete anatomy and measurements of the patient and we plan the procedure way before the patient is taken into the operation theatre. Even before we touch the patient, we are sure with the plans and what is going to be the outcome. Now once the patient is taken in the OT, we try to execute the plan, and this robotic arm, the Mako Striker robotic arm, will help us to assist to get the perfect alignment every time. This surgery is performed by the surgeon with the help of a robotic assisted arm of Mako technology. Here what we do is basically we have something called as a haptic boundary. Basically we are marking out or charting on the patient's bone where exactly we want to make our cuts and how to redesign the bone in the perfect manner. This haptic feedback helps us to stay within the boundary, and the moment your saw goes outside the boundary or near the boundary, it stops. This feedback helps us to get the perfection. The implant what we use is Striker implants. Those are the best in the class and is used worldwide. This robotic technology was available only in US and in Australia and few European countries, and now it's there in India. And we at Wockhardt Hospitals, South Mumbai, are the first to have this Mako robotic system in South Mumbai. So when people ask me, doctor, the conventional surgery is very successful, why do we need a robotic assisted arm to help you with this? So the answer is very, very straightforward. This robotic surgery has much more advantages over a conventional surgery. Here basically the incision or the cut made on the patient's knee is smaller, there's less blood loss, the pain incurred after the surgery is less, the range of motion or the functional outcome is much better as compared to a conventional surgery. The implant positioning or the prosthesis what we put, the new knee, the prosthesis ka positioning is very, very perfect. That helps in a longer lasting knee replacement surgery, and all these combined together gives the patient a feeling of a better and a more normal knee. This is where I feel the robotic surgery is giving us the additional benefit for every patient every time. Now this is very, very important, every patient every time. Thank you.